So should I be afraid right now to go to the hospital?
Absolutely not. It is still safe to go to the hospital if you have any medical condition that needs care. If you are worried about your personal safety because of a health condition, that's a time to go to the emergency department. If you are concerned that you need to be seen, but you're not feeling in danger, you should call the numbers that we have given you for telemedicine and talk with a healthcare provider to help decide if you need to come in to be seen or if you do not, or if we can treat you over the phone. The hospital is trying to limit the spread of coronavirus in every way possible. And one way is by being very careful about who comes to the hospital. We may try to limit you from having visitors in the hospital. But if you are concerned for your safety, do not hesitate to come to the emergency department if you are worried that you are very ill, or to call a doctor through the telemedicine lines that we have given you. If I go to the hospital, will the doctors try to enroll me in a vaccine trial?
Good question. There's a lot of great research happening right now at the hospital, but there are currently no vaccine trials in the state of Iowa. Like I said, there is a lot of great research happening in our community to find out a better way to treat and prevent this virus. The hospital has processes in place to ensure fair and safe treatment if you want to participate. Your consent is needed though, and participation is absolutely voluntary. You will not be forced to participate if you do not want to. So how do I take care of myself or someone in my household who has COVID-19?
Try to keep them separate from others and to social distance in your home in any way that's possible. So try to keep the sick person in a room by themselves, away from everyone else. The sick person should eat alone if they're able. If you have the opportunity, the sick person should have their own bathroom. Or if the sick person is able, they should disinfect the bathroom each time they use it. The sick person should have their own trash. The sick person's laundry could also be a source of infection. So if you are doing laundry for a sick person, wash your hands after handling it very carefully. A sick person should not share dishes or drinking glasses or cups or eating utensils or towels or bedding or anything that is used in the home that could have droplets on it. They should not be shared. After using those items, after the sick person uses those items, they should be well washed with soap and water. Other places in the house should be regularly cleaned. You should clean doorknobs, clean tables, clean light switches, desks, toilets, faucets, everything that gets touched frequently. Any surface that might have saliva or blood or stool or body fluids of any kind should be cleaned regularly. To disinfect, you can use disinfectant products that are labeled to kill viruses. You can also use a dilute bleach solution as a disinfectant. It has to sit on the surface for at least 1 minute. You can make dilute bleach solution from 4 teaspoons of chlorine bleach per 1 quart of water. At the very least, caregivers need to wash their hands every time they have contact with a sick person or their items. Proper hand washing is essential, and that means using soap and hot water for at least 20 seconds. If a parent tests positive for COVID-19, can they continue to care for their children in their home?
Yeah, this is a great question. It's difficult as parents to know how to manage the health of our children, and it's very natural for parents to worry about the health of our children. However, since kids who get COVID-19 tend to have very mild symptoms, they can remain home with their parents. Just follow the instructions we discussed in the previous questions about caring and taking care of your home and cleaning your home when someone is sick. The exception to this would be if the parent is simply too sick to care for their children. In this case, it might be good to have someone else care for your children. It is okay to ask for help, and there are resources out there.
I cannot afford to lose even a single day of work. Where can I find help if I become sick with COVID-19?
This is a big concern, and many people are missing work due to this illness. Unfortunately, not all employers offer paid sick leave. This makes for some really tough decisions when someone is sick. This is especially concerning if there is only one income in your household. If you show symptoms of COVID-19 or test positive for the virus, you must stay home and communicate with your employer immediately. Employers are advised to encourage sick employees to stay home. So you need to encourage your employer to call your local health department for recommendations. There are some protections for employees under the Families First Coronavirus Response Act. Please contact your Human Resources Department for help with these questions. You may also call the Iowa Multilingual COVID-19 phone line to connect to support services at 877-558-2609. You can select from over 18 languages when you call that number.
When can I go back to work?
You need to stay home and away from others in the house until the following 3 things are true. That 1, you do not have a fever for 3 full days without the use of medicine that lowers fever. 2, other symptoms are better, such as your cough and shortness of breath. Those are getting better. And 3, at least 10 days have passed since your symptoms first started. Talk with your employer and your doctor about when you are able to go back to work, and they will give you the best advice. We will have these questions and answers printed out and available for you to review and read on our website at chpiowa.org.